So the Alzheimer's Association last fall received a grant of about $175,000 from the Attorney General's office to do two things: implement a program of rural outreach in 4 targeted underserved communities. And actually the bulk of the funding we've used to hire the chapter's first full-time volunteer coordinator. So the broader context is the grants allowed us, with having the staff resource now, to undertake a much more coordinated program of volunteer recruitment and volunteer management, really across all 23 counties that we serve. But in the context of the rural outreach program, the 4 counties that we've identified are Jefferson County, Clallam County, Pacific County, all on the west side, and the Hispanic communities in the Yakima Valley. So the program is really focused on engaging local volunteers, primarily to become qualified and trained to facilitate support groups for us, but also to help us connect with other folks in the community to do other things, from care consultation to community education. We will be scheduling a series of public policy town halls in August. So all designed to really do 2 things: help us better assess community needs so that we can better leverage our resources to help folks cope with Alzheimer's and other dementias. We've got some great partners. The W4A, the Area Agencies on Aging, have been great. They're really anxious for us to get to the table with them with an implementation plan for the rural outreach program, which we're working on. Roy Walker is particularly excited because 3 of the 4 areas are in part of his district.
Sure.
Mark Harvey up in Squim is going to be a great partner on the ground for us up there as well. So that's what's going on with rural outreach. And really the approach that we're trying to take is sort of inside out. If you listen to John Zeisel's keynote today about community, we're trying to engage at the community level and use local community partners to help us find clients and volunteers and, oh yes, donors. Because for us, it's really a path that begins with us identifying a need that we think it's appropriate for our mission to try to meet. So we go to a community and we bring something, hopefully of relevance and value. More often than not, thankfully, the community appreciates it and invites us back. And we may go back a second time, but at some point we need to have a conversation with folks in the community about investing in our ability to be continuing resources. And in terms of sort of the structural issues, we're not in a position to open up regional offices. We might be at some day. We probably need to be, because so many of the people that need us and that we are serving already are not within a 30-mile radius of our office in Seattle. So the way to do this really is at the community level with engaged volunteers. The thing it does is it gives us things that we can model and scale up and out, which is very important to us. We do certain things really well, other things we're still learning how to do, and in particular, we need to learn more about how to make things more available and appropriate for communities. And this is particularly true with some of our minority communities, because there are cultural differences. I mean, John spoke to those during his session. There are cultures in which people with Alzheimer's go to the back of the house. And we're very cognizant of not trying to come in from the outside as people with programs and services and answers. We have to forge those partnerships from within the communities. We're having a group of folks are coming to see us in the middle of next month. We're going to have a kind of African American summit. We do an African American forum every year. And that's about all we do. And so fortunately, in fact, 2 of the women that are on the planning committee for the forum came and said, we really need to have a larger conversation
So this is going to help you broach other areas. As you get in contact with these people, you're going to be finding out a little bit more about what they need as well. It's kind of interesting. You talked about allowing basically the people in the community to essentially minister, care for their loved ones, empowering them to do that, and kind of what John was talking about. And I just thought, like if you go to Saudi Arabia, you go there, you learn their language, you dress, you eat like them, and it makes complete sense to come into a community, say, what do you need? This is what we're able to offer, and then have them be empowered to go out. And
it's the only way to affect true partnerships, and it's also the best way to leverage our always limited resources. I mean, for us, it's all about matching capacity to need. When I came to the chapter in July of 2011, I was introducing myself, and I would say, at the end of a hard day's work, we're reaching less than 7% of the people who need us. And then about this time last year, I began to say, at the end of a hard day, we're reaching less than 5% of the people who need us. And with the release of a couple of weeks ago of our new facts and figures, the annual compendium of data that the Alzheimer's Association produces, I am now saying, at the end of a hard day, we're reaching less than 4% of the people who need us.
wow.
And that does not include the anywhere from 50 to 70% of people living with Alzheimer's who have not been diagnosed. So it's a huge gap to close between capacity and need, and the better able we are to do that within a community locally, the better chance we have of reaching and serving more people.
And the better the care is going to be for the family.
Absolutely, yeah. And the advocacy piece of this, if we have more time, I'll transition to that. The vision for these public policy town halls, there is a new national Alzheimer's plan. And a couple of years ago, we did a series of town halls, and it was about inviting community input. What are you dealing with? What are your challenges? What are your obstacles? What do you think ought to be in a national Alzheimer's plan? And we got some fantastic input from all across the country. So now it's time to go back out to the community and say, so we have this national Alzheimer's plan. Is it working for you?
Yeah.
Is it giving you what you need? And then the second part of the conversation is, Washington State is one of only 7 states that hasn't even begun work on a state Alzheimer's plan. What do you think ought to be in that? So that would be the focus. But the other thing about the public policy town halls is they're incredibly valuable for us, getting back to that earlier theme, because we may invite people to tell us what they think about the national and the state plans, but in the telling of that, we pick up a lot of really valuable information about community need and community resources. Well, we have a very broad spectrum of service area, from urban to rural, and the truth of it is, I mean, there are people within the Seattle city limits who don't access the help they need because they don't know where to find it. So the whole awareness piece is a big part of it. The other thing about advocacy is I think it's a very easy way for us to engage people. And once we've engaged them and they learn more about us, then the opportunities surface to either provide them with appropriate service and support, or leverage their connections to find those partners and those donors and those community leaders that get our message across and generate some support and even some investment in our work.
I think you're right. I think people want to naturally be involved.
Yeah. And it's every now and then I'll have an aha moment on the concern and awareness front. I was at a health public policy conference out at CTAC. You guys might have been there too a couple months ago. About 600 plus people, big deal. And I'm standing in the hallway at one of the breaks, and people are just flowing, back and forth. And this woman walks by me and does this. I thought she had given herself whiplash. Turned around, came back. I was wearing my logo pin and my name tag, and she just kind of stared at me for a couple of seconds, and she said, "There's an Alzheimer's Association?"
Wow.
The woman is a hospital administrator in Spokane.
Wow.
So you can never take for granted that even true professionals who are in the business know that there's an Alzheimer's Association, much less what we do or how we help. So,
wow. Well, thank you very much for your time. I really appreciate it.